Are you or do you know of someone that has either type 1 or type 2 diabetes? Type 1 diabetes is where the body is not able to produce insulin to break down sugars within the body. Type 2 diabetes is where there is insulin that is produced, but there is not enough insulin produced to break down sugars within the body. So type 1 and type 2 diabetics have to regulate their blood sugars by either type 1 diabetics have to take they have an insulin pump or they have insulin injections that regulates their blood sugars. Type 2 diabetics have medications such as metformin that help bring down their blood sugars to an adequate level. Typically, diabetic patients have a higher blood sugar reading than normal people because they are not having the adequate amount of insulin produced within their body. So, diabetes can cause multiple problems within the body if the blood sugars are not regulated. So, diabetes can cause a deterioration of function in the heart, in the kidneys, in the eyes, and even in your feet. I would like to specify and focus on how diabetes can affect the function of your feet. I am a medical assistant at a podiatrist office, which is a foot and an ankle specialist. And the majority of our patients are diabetics because they have to be seen regularly because they cannot feel their feet. Typically, diabetes causes neuropathy, which is a decrease of function in the nerves that are within the feet. Diabetics who have neuropathy, they cannot feel their feet. They have numbness in their feet 24/7. Except for whenever they're off their feet, they have painful numbness, tingling, and burning pins and needles sensation in their feet. And it sometimes can prevent them from falling asleep because they are not able to go to sleep with the amount of pain that they experience in their feet. So they have to take medications such as Lyrica or gabapentin or even some nerve vitamin supplements to help cure those symptoms that they have at nighttime. Sometimes the nerves cannot be completely replenished once they're damaged. We hope that they will be eventually, but most of the times the nerve, once they're damaged in the feet, you cannot replenish those functions. You can only treat the symptoms that they experience. Patients who have numbness in their feet because of their diabetes, it is very dangerous because they can step on something and not even realize it until later on, and then they have a bigger problem. We have a patient that has been there for 5 years, and she's a diabetic patient, type 2, and she had stepped on a piece of wood in the house and did not know about it until a week later. Well, she had a hole a week later that was infected in the bottom of her foot. So she was being treated for this for 5 years, and just until last month it had finally healed. Because diabetes can not only cause a deterioration of nerve function in the feet, but it also prevents adequate healing in the feet because the blood sugars are so high. It prevents the body from being able to heal properly. So I encourage, if you know somebody or if you are a diabetic patient, see a podiatrist at least once a year because it reduces the risk of amputation at least by 85%. Check your feet regularly at nighttime. See if you had stepped on anything throughout the day. Always wear shoes. Never go barefoot. Exercise regularly and bring down those blood sugars. But diabetes is an ongoing thing, but it can be regulated and it can be prevented from the decreasing of the nerve function within the feet if you take care of yourself. I hope y'all have a wonderful night. Thank you for listening.